Welcome to Washington Watch with Congressman Walter Jones. Each month, we take a look at the events happening in Washington, D.C. and how they affect our lives here in eastern North Carolina. And now, here's your Congressman, Walter Jones.
Welcome to the August edition of Washington Watch. I am so pleased and thrilled to have today as our special guest North Carolina Senator Richard Burr. Senator Burr grew up in Winston-Salem, North Carolina, attended and graduated from Wake Forest University and played some football there, as a matter of fact. Senator Burr served 10 years. We were colleagues in the U.S. House of Representatives before he was sworn in as United States Senator in 2005. Senator Burr serves as ranking member of the Senate Veterans Health Committee, where he works to improve the quality of health care and service our nation's veterans. He also sits on the Senate Armed Services Committee, the Health, Education, Labor, and Pensions Committee, the Energy and Natural Resources Committee, and the Intelligence Committee. Senator Burr is committed to promoting job growth by working to restore a vibrant environment in North Carolina. He is a vocal advocate for our men and women in the military and their families, and for the growing population of veterans across North Carolina. Senator Burr, I am pleased and honored to have you on this show. It's been a long time.
Great to be here.
Thank you.
Thanks, Walter.
Senator, you and I share the same feelings about this health care bill that became law. You were very outspoken in the Senate on this, and I want to thank you on behalf of the citizens of the 3rd District of North Carolina for being a strong advocate for the people who were concerned about the growing influence of government in health care. Can you speak on this, because you really have distinguished yourself out front on this issue?
Well, yeah, I can, and thanks for inviting me on the show. More importantly, thanks for letting me share some thoughts with your constituents and my constituents. I believe that this health care plan will do more to damage the future health care of this country, the innovation that we've come to expect every year, the breakthroughs that happen, by government becoming too involved. And I think this is just the start of it. But let me say this, over and above the quality issues in health care, this is a $2.5 trillion health care bill. This exacerbates the spending and debt problem that we have in this country, and by itself could singly push us over the edge and into the abyss where we couldn't recover. And we do it at a time that the United States Congress, the President, the administration should be focused on how we put Americans back to work.
Well, Richard, thank you again, because you're right. I think, and please correct me if I'm wrong, that if this health care law stays in place without any tweaking along the way, and we'll talk about that in a minute, that it could cost well over $2 trillion over the next 10 years. Is that correct?
I think it's more like $2.4 trillion, and whether it's your congressional district or the 1st or many areas in North Carolina, the effects of downside effects of this health care bill is that rural health care will be all but gone. We'll see facilities be closed because the reimbursements for hospitals, for clinics, for the medical staff that it takes just won't be there. We'll see the healthcare professionals migrate to urban areas where even the government knows we have to have healthcare facilities. But it's rural America, rural North Carolina that's really going to suffer from the government taking over control of healthcare.
Well, Senator, let me also ask you, I have been saying back home that in this forthcoming election, if the Republicans could have one house or the other, that maybe there would be some way that there could be some review of certain aspects of this bill, that maybe even if we did not take both houses, but one or the other, that maybe there would be an opportunity to start a dialogue or a discussion with the administration, that there's so many aspects of this law that are dangerous to the American people. Do you think that would be a possibility?
Well, you and I both know the realities of where we are, and that's that if we passed repeal because of a change in Congress, the President's not going to sign it.
Right, that's right.
So as members of Congress, and I can only speak for myself as a member of the Senate, I think the smart thing to do is for us to defund the implementation of this health care program, to starve those regulators of the tools that they need, which is resources, financial resources, to make the regulatory decisions. We've empowered the Secretary of Health and Human Services to make practically every decision about this country's health care in the future. That happens to be Kathleen Sebelius today, but it may be somebody tomorrow that didn't become secretary, but on a 51-49 vote. I'm not sure that I want to put that much power in one person's hands that certainly controls the future of health care for this country. We've got numerous independent advisory boards that are going to be set up to determine what the reimbursement should be in the future, taken totally out of the hands of Congress. Any ability to mold and shape what the needs of the country are based upon our constituency, based upon what's in the best interest of the American people. And I think it's that takes the incentive away from investment and capital outlay to find that new breakthrough, to begin to solve health care problems by curing diseases versus simply maintaining them. It might be expensive up front, but in the long run, if we cured diabetes versus continue to maintain diabetes, the nation has a huge savings.
Thank you for sharing your thoughts on that, because it really is it's one of those issues that seems to always be in the forefront, even though we're all concerned about jobs, and I'll talk about that in just a second, and the growing debt and deficit. There's no question, but always in that discussion, health care always comes forward, because the people in the 3rd District, which you have the privilege to represent as our senator, that this is an ongoing issue, and there's hope that some of the you just made, I think truthfully there's hope even among the American people, as a matter of fact, that maybe there can be some significant changes to return health care.
Walter, let me say, this just fuels the concern that people in North Carolina have and people have around the country about the size of government, about the reach and the intrusion of government into their lives. And I think this is going to be the debate as we conclude this year. It's the proper role of the federal government in the lives of every American. And I think that's where the common thread of anger and the common thread of concern is with the American people today.
Well, it's definitely, the environment is one of frustrations, and no question about it, and you just articulated that extremely well. Let me go to your feelings about the Debt Commission, since we have Senator Erskine Bowles to Alan Simpson, who's former senator from Wyoming, and Erskine Bowles, who is president. I was about to make Alan Simpson the president of the university system, so I about got that. But do you see some merit from the standpoint of bringing some issues forward that you think that we in the next Congress should look at, whether we agree with those or not, but at least have debates about them?
Well, let me say this up front. I have the ultimate trust in Erskine Bowles to chair the Debt Commission. And I feel like I know Erskine since we ran against each other.
You did, that's right.
And there's not a person that I could as confidently pick to chair that commission as I would Erskine Bowles. I believe he will call balls and strikes. And I think he played his hand a few weeks ago when he spoke to the National Governors Association, Republicans and Democrats, and he looked the governors in the eye and he said, you can only get there by adjusting as much as 75% in of spending versus increase in revenues. We see a commission headed by Erskine Bowles that's going more towards cutting spending to live within our means than how to target people to raise revenue, and I think that's absolutely essential. I think the commission is probably what it's going to take to bring common sense solutions to the issues of Social Security long term, of Medicare and Medicaid long term, the entitlement package that we have. But I think it's important for your viewers to understand that when Republicans lost control in Congress, our deficit was about $160 billion. Today it is $1.4 trillion on an annual basis. And as a country, that means today, if we didn't borrow another dime, we owe $5.68 trillion in interest payments alone over the next 10 years. Erskine Bowles understands the math. The commission, most members understand the math. If you don't stop spending, you can't get a handle on this. And if you can't get a handle on spending, then what good is it trying to reform the entitlement programs, and I think that's why they're taking on the whole package.
Senator, thank you for your comments, but also your kind words about Erskine Bowles. I feel the same way. I will tell you very briefly that the horse bill that we put in back in 1998 to save the little horses down at Carteret County, and you were in the House at the time, you helped me with this, that if he had not been Chief of Staff to Clinton, I'm not sure it would have become law because the Interior was opposed to the bill. So anyway, I agree with you in your comments about what is really important is that we figure out how we can come together and try to get America back on the right course. I want to thank you again. You are the ranking member on the Senate Committee on Veteran Affairs, and you and I both share our concerns about our veterans today, but also our veterans tomorrow. The reason I wanted to bring this up is that I just finished the book by Joe Stiglitz. He's a well-known economist. It's called The $3 Trillion War. In that book, he projects that in the next 10 to 15 years, to take care of our wounded from Afghanistan and Iraq, that we could be talking about a minimum of $2 trillion. And you being a ranking member, and that means if we became the majority, you at least have the option of being the chairman. But being a ranking member is very important. I know that y'all have to be concerned on that committee as to the future cost of trying to take care of those who deserve to be taken care of because they've given so much.
I think you stated it exactly the right way. I'm not as concerned what the cost is because I'm more concerned with keeping our promise, making sure that those men and women have the tools they need to make a successful recovery regardless of what the injury is. Some are visible, we can see them. Some are inside and they're much more difficult to treat and much more difficult to detect. So my focus has been on how we transition the VA delivery system of healthcare into a 21st century healthcare system. We've seen a transition in the local communities that we all live in. We've begun to see the surgical procedures that can be moved from inpatient to an outpatient facility. That way you can return home at night. The cost is down. The convenience for the patient is better. We have that capability several years ago in the VA. Now we're starting to stand up in North Carolina by 2013, 3 healthcare centers, one in Charlotte, one in the Triad, one in Fayetteville, that will have a full ambulatory outpatient facility as well as a full array of benefits. A veteran should be able to go to an HCC in North Carolina and get 95% of all the care they need, never having to step on the door of Durham or Salisbury or Asheville's hospital. It means that we take the most difficult and challenging cases into the hospitals. And it means that we get an expertise in these HCCs that spreads out then to the local outpatient clinics, whether it's in Greenville or New Bern or Wilmington, that we can expand the services there. We've got to get better at how we deliver the care. We can't have a debate in Washington as to whether we deliver the care.
You're right. One of my biggest concerns, I know you do the same thing. All members of Congress, both parties, House and Senate, we take time to go to Walter Reed and Bethesda and to visit the wounded, and I hope that we can, as you suggested, be smarter, because I do worry about, and I know you do, the growing debt and deficit, and knowing that we had a young man on the floor Monday night. He was Army, lost both legs and an arm, and they were able to the floor, and members applauded. It was just heart touching and wrenching to know that these young men and women, God bless them, they might live to be 75 and 80, and there's that responsibility.
And as you know, it's North Carolina soldiers, airmen, Marines that are on the tip of the spear. They're the ones that are first called. They're the ones with the most active rotation in and out. And I got to commend you, Walter, because you've been a conscience on the responsibility that we have to these people, the cost that's incurred, but you've always been a stalwart to stand up for our military. And in North Carolina, the military is a foundational issue of our state. We actually are the only state that received a benefit at every military facility, the results of BRAC. we'll plus up with family some 70,000 people at Fort Bragg alone. About 9,000 Marines at Camp Lejeune, and with family about 21,000. A positive impact on Seymour Johnson. The military becomes more and more a part of the fabric of North Carolina tomorrow than less.
Richard, thank you very kind. Your kind words about my commitment, and certainly yours is there equal, and we're going to continue to work for those veterans. And as you said, and you're so right, the military is a vital part of the economy of North Carolina, not just eastern North Carolina, but North Carolina. And we're lucky to have the military, as you made reference to. I want to thank you. We got a few more minutes, but I want to thank you for joining Pat Roberts in his effort to name the Department of Navy and Marine Corps. And I want to thank you. You've helped him. He is somewhere around 79 to 80 senators on that bill. We still have opposition to it, but I think that with your help, that Senator Roberts is going to battle this thing, and who's to say it might become real?
Well, as you know, when you started this battle, there was no light at the end of the tunnel. And today we can actually see an end to the tunnel. We don't know what's going to hit us in between there and the end.
That's right.
But the truth is that we have a real opportunity to change the name and to prominently place the name of the Marine Corps as it should be.
Well, again, I want to thank you and the other senators who are helping Senator Roberts. I was real quickly. We had 425 members and brought it up on the floor under unanimous consent. Nobody was opposed to it, so it passed it. And I felt like that. I said, that's pretty good. And then about 4 weeks later, I heard that Pat Roberts had 79, 80 senators. I said, boy, he has really put me to shame because he did it in such.
Well, as you know, things that sit in the Senate for a long time get better, which is how most legislation happens. We don't do anything quick, and that's historically the way it happens. But a large majority that are committed to get this legislation up, get it through. It's just a question of when.
Well, I thank you again for your leadership and being part of that effort. We have been doing this show for a number of years, and Senator, you were on this show when you were a House member, and now that you are a Senator, you're on this show, and I want to commend you. You have certainly been outspoken on a lot of the issues that the 3rd District is concerned about. We talked about most of them today, and there's only a couple minutes left. Would there be anything that maybe you would like to mention that I didn't ask you that you think might be of interest?
Yeah, I would, because I think you and I fall into the same category. We talk, we go home every week.
Right.
We talk to a lot of North Carolinians. Number one issue that's raised is people back home don't think that Washington listens. They see your leadership, the Speaker, and I understand why. Because things happen, they're jammed, there's little debate. There's very little outreach to the average person across the country to say what would affect you in a more positive way. The disregard for our economy and job creation. You know this better than I do. We're going to double the debt in the first 5 years of this administration. Double the debt means we will double the first 43 presidents in our nation's history. And we'll triple it in 10 years based upon the budget projection. The average person back home understands what you and I do. That's unsustainable. Therefore, we've got to change. Yet they see the leadership in Washington not making any attempt to do it. I want your constituents to know there's some of us up here that want their input. We want to know what affects their lives positively. We are trying to bring the brakes to the out-of-control spending. We understand the unsustainability of it. More importantly, we know that we can't do it alone, that it requires a tremendous partnership between the Congress and the American people, old and young. And I think the refreshing thing is that we see a level of engagement by the public, not just in North Carolina, but around the country, that we just haven't seen in a long time.
Senator, I want to thank you again for being on this show. It's always a pleasure to be able to talk with you and to see you. And again, I want to thank you for your service to the citizens, not only of North Carolina, but this nation. In just about 1 minute, Glenn Downs, my Chief of Staff, is going to be on this show. We're going to talk about some issues that are office in the last week and 10 days. Thank you.
Thank you, Walter.
Great job. Welcome to the second part of the August edition of Washington Watch. I'm delighted to have Glenn Downs on the show now. We've got a lot of issues to talk about, but we've got a short period of time.
Well, Congressman, thanks again for having me back, and I'll be quick. I know you want to talk about some big issues because the people of your district ask about some big issues. Let me start off with something a little bit smaller. You and Senator Burr just talked about your effort some time ago dealing with the horses down at Shackelford Banks. And a lot of people are interested up in the northern part of the district, and people that vacation out in the Outer Banks, the upper part of the Outer Banks in Currituck County, about a similar bill that you're working on to protect a herd of wild horses that exist up there. Can you talk a little bit about that and just about the history of those horses and why that's something you're working on here in Congress?
Glenn, the experts, Dr. Dan Rubenstein, Dr. Gus Cothram, who's now a professor at Texas A&M University. These are experts on these horses in North Carolina. They have been able to trace these horses back 4 and 5 centuries. Spanish Mustangs that were brought over on the ships. The ships wrecked, the horses swam ashore. And we've got a bill that we put in, and I want to thank the Corolla Wild Horse Foundation. Karen McAlpin came up here this week and testified before the Resources Committee. We want to create the same program for the horses in Currituck County that we have down at Carteret County. That's what I mentioned to Senator Burr, that Erskine Bowles had helped. He was chief of staff to President Clinton to help with those horses, and actually Mr. Bowles has sent us a letter that was read at the hearing that I just mentioned, that Karen McAlpin did a wonderful job of testifying in behalf of protecting these little horses.
So, but the issue, as I understand it, is that there are some bureaucrats in certain departments of the federal government that want to treat those horses that have been there for hundreds of years as if they're like a pack of wild dogs that need to be removed, or their numbers need to be reduced or something.
Well said. The Fish and Wildlife, we hope that they will work with us once this bill becomes law. Not us, but the citizens of Currituck County. And you're right, the scientists have said that those two I mentioned just a moment ago have said that we need a bottom of 110 horses. That is to keep the diversity, the genetics, the breeding, everything would be proper if we can have a floor of 100. So that's basically what the bill does. Plus it brings in the private sector, the Corolla Wild Horse Foundation, those on that foundation board, to meet with the Fish and Wildlife to make sure that they have a management plan that is good for the horses, that the federal government will make sure that we protect the horses.
That's great. We're backing up just a little bit. As we meet here today, Congress is on the verge of going on what is typically referred to as a August recess, or a August district period, and a lot of people want to know what that's about. Congress shuts down, but our offices are still open. We're still open for business. So what does a member like Walter Jones do during the month of August?
Glenn, I have always, during the month of August, even in a non-election year, I have made myself available to the people of the 3rd Congressional District by traveling the district, going into for civic type issues, meeting with different groups within the district that would like to meet with me. And I think all members do about the same. I don't take overseas trips. I don't fault those trips, but I just don't do it. I'd rather be with the people in the 3rd District. And in fact, I must say that for those 35 or 40 days, we're very busy. We have every day but just about a Sunday, and there are a couple Sundays I will be going to events, but primarily Monday through Saturday in the 3rd District of North Carolina, meeting with the people on a regular basis. And I want to thank the staff in Greenville and the staff in Washington, because I'm very fortunate to have a great staff in both locations.
Well, on behalf of the staffs, we thank you for thanking us. But it really is, it's an opportunity and it's a privilege to be able to do the things that we do on behalf of the taxpayers, and it's very gratifying when you, I know as a member of your staff, are able to actually particularly help a particular problem with an agency of government. You can help somebody get out of a ditch, and that's really makes the job worthwhile sometimes.
It does.
You had, as an aside, you mentioned the congressional travel and the fact that you don't do it very often. I mean, outside of these so-called congressional delegation trips, CODELs around the world, where people go to beach inspection trips in France and things like that. You have legislation. You have had legislation which would not stop that necessarily, but require more disclosure.
Right.
Who's going where? What does it cost? What do some of your colleagues who do like to take those trips a little more have to say about that, attempt at sunshine?
Glenn, I'm not getting any movement on the bill. I put it that way. My feeling is, at any time, but especially during a deep recession like we're having, for goodness sakes, let the taxpayer know how you're spending the money. And when these trips are being made, I don't think they should make any trips going to see the troops, whether it's within this country or overseas. But some of these trips about, like you were saying, to analyze the beaches in France, I mean, there's some trips that I think are very questionable, but the average person, meaning members of Congress, cannot find out what these trips cost. And I don't think that's right.
Well, I know we're just about out of time. You're on the Armed Services Committee and a senior member there. There's just a report about some $8 billion in Afghanistan and Iraq that just unaccounted for, again, without getting into the efficacy of the efforts there. Just talking about transparency and accountability, do you expect anything to be done more about that?
Glenn, I hope so. I'm always pushing for more oversight in many areas of our Department of Defense. But Glenn, time's about out. I want to thank you, Senator Burr, and also say to our men and women in uniform, God bless you. Thank you for what you're doing for this country, and may God continue to bless America. Thank you for watching.
Thank you for taking the time to join us for Washington Watch.